Hello everyone, I am Dr. RMD, Pediatric Resident at PGMER Dr. RML Hospital, New Delhi. And today's topic that we are going to talk is what next. So you know that NEET PG results have been delayed. So at the latest, as of now when I'm shooting the video, the next date for counseling is on November 19, which is very late. Okay, your exams were in August. Okay, then now it's October. Just registration has started, nothing else has started. Some state medical counseling processes have been started, but that too only registration process. Okay, and after October we are going into November 19th. So accept this fact that till November end counseling is not going to start, because next Supreme Court hearing is after Diwali session, and after that the earliest date that is possible is November 19th. So it is anyways after November 19th. So anyways till December 1st no counseling process is going to start, nothing is going to happen. Okay, so whatever is going to happen will be after December, and then most probably the joining is likely to be in by January 1. So if everything happens on time after Supreme Court hearing, only then there will be counseling, like the joining date will be probably by January 1. So now some of them will ask me like there could be some official rumors, not official, unofficial rumors that counseling process will start and like MCC won't wait for Supreme Court hearing. No, it is not going to happen. The reason is simple, because if there is transparency, there is a problem with transparency of marks, or that NBMS should reveal marks, then it will have an impact on especially state counseling, where in-service candidates will get bonus marks with the counseling results. Okay, so that's why it is very unlikely that MCC, even if it goes ahead with counseling process, then definitely Supreme Court will put stay on that. Okay, so effectively now NEET PG aspirants who had completed their exams in August have time till already have wasted 3 months. Okay, so now we are again going to waste 2 or 3 months. So I have come up with certain things that you can do in this 2 to 3 months, which will actually help you in your future as well as in the present. Okay, so what should aspirants do now? Okay, so there are two types of categories of students who are there right now after NEET PG results. Okay, one who will definitely get a seat this time. Okay, so believe me, as much as possible try to get a seat in this attempt only. Okay, this PG counseling only. That is because every year passes by, things get on becoming complicated. We don't know what NBMS will do next year. Okay, government is literally playing with the lives of the students here. So if you're getting a seat this time, then good. Okay, if you're in a safe zone, or if you are not getting any dream branch, okay, go for option 2 or option 3. Be flexible. Okay, now is not the time to be perfect. Be more flexible. Okay, adapt to the surroundings, adapt to the changing times. Second, who are in doubt, okay, especially mid rankers, like after 20,000, okay, 20,000 to like 60-70,000 rank, who are even who are like doubtful whether they'll get a seat or not. Okay, it's not about whether you get your dream branch, it's about whether you get a seat or not. For them, I'll say that if you are even in the slightest doubt that you want to drop or you want to repeat, then go ahead with your preparation, because these 2-3 months where counseling will be going on delayed. Okay, you know how COVID lockdown was. Like COVID lockdown initially was planned for 1 month, then 2 months, and it went up to 8 months. Okay, similarly counseling process will go on dragging. So don't wait for all this. Now is the golden time. Even if you have slightest doubt in your mind that you should repeat or you should drop, then go ahead and start your preparation. You won't get this golden time again in your life. Okay, so also for those people who are going to drop or going to repeat again, okay, for them you watch the last 2 minutes of this video. Go directly and watch this last 2 minutes. I have given some useful tips at the last. Okay, so rest of those who are waiting for counseling, okay, this video is specifically for you, or even those who think that you don't want to give one more attempt and now you want to go ahead with counseling, whatever, you have so much free time left. So what you can do, what I did, I'll tell you from my experience. Okay, so one more thing is counseling will get delayed by more than 2 months. My belief is that it will get started by January only. Okay, by January 2025, my prediction. See, when everyone was telling that, I had released a video, I think in the month of August, where I told that counseling process will get delayed. It will get delayed maybe after INICET only it will happen. So from the beginning itself I was telling that counseling won't happen before INICET in November. Okay, there was a specific reason for this, because I knew that whenever this normalized ratio is used, normalized scores, that time there will be definitely issue of transparency. Okay, and now also I'm going to tell it will take 2 more months at least. That is because one reason is, suppose let's say that NBMS has released the scores, okay, like normalized score. Okay, so for example your score will be 130, but maybe your normalized score is 145. Now even if NBMS released, counseling proceed again, okay, but then someone will come up with the doubt, someone will tell that this is not transparent, someone somewhere will find some problem with this, okay, just like that happened with NEET UG. So again someone will go ahead with Supreme Court, or they'll go ahead with case in the court that this like the whatever MBMS exam was conducted, that was unfair, so you have to conduct it again, okay. So this is a possibility. Second, let's say that NBMS is not at all ready. Right now the stand of NBMS is that it is not at all ready to release its normalized score, okay. It is not ready to become transparent. Never in the history NBMS has been transparent, so I still doubt it that it will be transparent, okay. So if it is not transparent, then what is the problem? The problem is not with the court case, the problem is with in-service candidate counseling, okay. That is because in few state counseling, in-service candidates get extra bonus point for serving in remote areas, okay. So like 30 marks will be extra added to their score, but what if NBMS doesn't release the score? So these people don't get that advantage. Now these people will go and they'll start they'll like complain in the court, they'll start a new case that it is disadvantage for us because already in state counseling there was a rule earlier, like last year it was done, but now it is not being followed. So there will be new problems like this, okay. So definitely one of the, in both sides, okay, yeah, like there is checkmate. So you guys are really doomed, okay. So what can you do in this situation, okay? So this is just my frank advice, okay, that next 2 months is anyways going to be waste only. So if you just wait for counseling and just hear all these results and all this news, rumors and all, you are just going to you are just going to increase your anxiety and all. So these are some effective things that you can do. So first question that you should ask is whether you are financially okay or are you financially burdened, okay? So these are the two categories of students that I have faced, those who ask me questions, okay? So if you are financially burdened, what you should do, okay? You want to earn. So these are the following options that you can do, okay? Even after MBBS, you can do all these things. One is you can join as non-academic JR in any college, but again, there is lot of competition for this post. The second best option is freelancing. If you're in a metropolitan cities, you have more opportunities, but you will think that in peripheries there is no opportunities. No, you are wrong. For freelancing, you will get opportunities anywhere, okay? Even my counseling was not delayed. It happened within 5 months, okay? But still for 1 month, I had done freelancing job at a private hospital nearby my house only. So I could earn what was necessary for me, okay? It was not very less also. For each night duty, I was paid around 3,500 2 years ago, okay? So like if I did like even 15 or 20 night duties, 1 month of salary is there itself, okay? So this was what I did before my counseling. And also it is not very easy because you won't have vacancies everywhere, but every hospital in periphery or maybe in cities also will need someone who does night duties, okay? So there your role comes into play. You don't have any accountability, you don't have any responsibility, you just go there, do the job and you come back. Okay, so this is like this is better option than joining any GR shift. So those who are like in this 2 months free, don't have anything to do and want to earn money, I'll say go for freelancing, okay? It is also called locum in Delhi, I think, yeah. So third option is you can join any coaching platform. See, you guys are the ones who are the experts in MCQs. It is not the MCQ framers or the examiners who are expert in MCQs. You guys are the ones who are expert in MCQs because you have been solving MCQs since last 2-3 years, okay? Or even since 1 year, you would have solved thousands of MCQs. So you guys are the expert, and all these coaching platforms, they need experts for framing QBank or editing QBank or for modifying their questions, for proofreading, okay? So there were many of my friends who joined like Marrow, Prepladder, Bhatia. I think you have to approach them, okay? Approach at their mail ID or something, that if there is any vacancy to call you for this MCQ editing, okay? You can get a job at MCQ editing or maybe some video editing or something, okay? Fourth is coaching apps promotion, okay? Like new coaching apps that are coming up, they will need promotion. They'll need people who can reach out to medicos, okay? So this is also one thing that you can do. So these 4 things you can do. There are many other things also you can do, like for example video promoting, okay? Video editing. Video editing is in very much demand nowadays, so you can do video editing for some companies. So that will be later on useful. I'll tell how, okay? So what are some self-development tasks that anyone can do during this free time, okay? Self-development tasks which are very necessary to succeed in life, okay? First is financial literacy. I stress upon this very much. Financial literacy is very important. Financial literacy of medicos is very, very, very poor. Okay, so what will happen is, now you will come to your PG and you will start getting stipend of 50,000. Every state has a stipend of above 50,000 only. Okay, so it will range between 50,000 to 1.2 lakh. So in your PG you won't be able to use this much of money. Okay, everything cut, you will be doing savings of at least 50,000. So how to invest this 50,000? Now once you enter your residency, you will have no idea. Okay, so how to exempt yourself from taxes also, that is also a very important thing. See, these are the things which I was not able to do initially. I didn't give importance to this, but now I regret that I had wasted initial 1 year for not knowing all these things. Okay, so for financial literacy, if you are a beginner, I would suggest the best video is a financial literacy video released by Dr. Aditya Gupta, I think 1 year ago. That will tell you all the basics, what is required. One step ahead, for all other matters, you can follow this Dr. Tanmay Motiwala. He has a YouTube channel, Dr. Tanmay Motiwala is the name, and where he gives he has released all these videos related to personal finance. Okay, so personal finance and this financial literacy is very, very important. Okay, or else all this whatever you have earned in this 3 years of PG will simply go into waste. Okay, so keep everything ready for investing just before your PG. This is one thing you must do. Okay, this thing is a must. So second is social media presence. I tell this because I realized this after joining after starting my YouTube and my Instagram, Telegram and all. See, what is popularity nowadays? Say you go let's rewind back to 10 years ago. Okay, 10 years ago, if you want to know a good doctor in your area, you will ask your relatives, you will ask your friends, you will ask like whoever have visited that hospital, or you will ask some other patients. Okay, but today what is popularity? Today popularity for a doctor is social media presence. How will you know that a doctor is good? You will search on Google, who is the best doctor. You will search on YouTube, who is the best spine doctor available here, who is the best endocrinologist available in this area. So unless you have a social media presence, you are not going to move ahead in coming years. Okay, so the best way to start is starting with small steps. Okay, I won't recommend you starting YouTube all of a sudden, because YouTube requires research, it requires investment also. Okay, it is not like that. You can also start directly. I started but I had done research for around 2 to 3 months. It's not like today I got the idea and I started today. No, I had done extensive research upon YouTube before starting this. Okay, I had to understand that algorithm. If you have this time right now, go ahead with this. Okay, YouTube, Twitter, the Quora, Instagram, okay, Facebook, all these platforms, try to make your presence. Okay, you don't, maybe in future you will be a pediatrician, or maybe you will be a general surgeon or something else. Okay, but right now if you know the basics of this, it is easy to add on to this later on. Okay, for example, if you are a pediatrician, let's say, you can post case based videos which are very much in demand. Okay, these reels on like pediatric population, I mean the children, they are going very much popular nowadays. Okay, so once you have already everything set up, it is easy to make the account public. Okay, so third is personal life. Believe me guys, if you are single, it is best time to find a partner right now. Okay, you are anyways free for 2 to 3 months. Okay, so use dating apps or social media or whatever. Okay, you won't get time for this during your residency. Even in your residency, you will be in a hurry, or maybe you might get a partner. Okay, so I think it is better to find a partner now only. Okay, so now don't ask me to create any matrimonial or site or Telegram group or WhatsApp group. Okay, so I'm serious guys. Okay, start finding a partner now only. Find a partner now, or else you will land up single like me. If you have free time, okay, do these also. Okay, these are some of the non-financial, non-self-development things that will help you build up your life. Okay, so for example, first one is travel. Right now is the best time to travel. What I would suggest you now is go do freelancing, earn some money and travel. Okay, do this, go on repeating for 2 to 3 months. You have nothing else to do. Okay, enjoy your life. Okay, so why travel? Because when you travel, you'll get this new ideas. Even the idea of creating this YouTube channel, and how do you think I get all these ideas? Do you think when I'm like during my residency, when I'm posted in the WhatsApp, I get these ideas? No, when I travel, when I explore places, that is when I get these ideas of the new ideas that is created. Okay, all these new YouTube ideas I get from all these explorations. Best places to visit right now in October and November, you can visit Uttarakhand, Kashmir, Kashmir, Darjeeling, Northeast, especially Meghalaya, this is the best time to visit. Coorg, Ooty in South India, Andaman and Lakshadweep. See, I'm all telling all this because I also had plans to go all these places, okay? But in residency, I'm not able to go. So right now is the best time. Don't waste this time. Next, visit your school or college, okay, your previous schools, your previous college, okay, so you will be happy, you will feel this inner happiness once you visit all this. Visit your teachers who have taught you, okay, so meet your old friends, you might have lost contact with them, go meet them. You are anyways free only, you are not doing anything. Also, important thing is, if you haven't had any driving license, or you haven't made your documents, or you haven't made your passport and all, now is the best time to do that. Fourth is, focus on your health, okay? Start a daily routine, like you wake up at 6 o'clock or you wake up at 6:30, start exercising, then start with some research oriented things initially, or maybe social media presence, or dedicate 2 hours for financial literacy or something. Start install apps like Grow or Kuvera, okay, or Zerodha, okay? Start knowing about it. Once you start only, then only you will know like how to invest in all these apps, okay? Like how to use all this app, how to invest, okay? Next, start hobbies, like start gardening, cooking, or if you are very good at MCQ, start conducting quizzes, like just as we have conducted JuxtaMed. We just came up with the idea, we just went ahead with it because we had so much experience with quizzing, okay? So remember that this is a golden time, okay, which will never return in your life again. This is a never returning opportunity, okay? So right now, if you are in a query that whether you have to take a seat or whether you have to take a drop, so you can always contact me. The best way to contact me is through live mentorship, okay? Live mentorship on YouTube. On YouTube profile, there is a button called join button. You can join live mentorship sessions, okay? So this live mentorship sessions will, in this I'll be directly interacting with you on YouTube live, and you can ask me any number of questions, okay? We'll have 3 to 4 sessions. Every weekly we'll be having 1 session. It is basically a guidance session, what to do next, okay? Also, what have you decided regarding whether you will drop or whether you will take a seat, okay? And what are the disadvantages of taking a drop, okay? What is a dropper story, that I have discussed in this video, which you'll see in the background, okay? This video will tell you in detail how being a dropper sucks, okay? Being a dropper sucks, okay? And this video will tell you how to come out of that droppers issue, okay? That is dropper cycle, okay? So if you haven't watched this video, go back and watch this video. You can also drop your queries in the comment section. I'll be ready to answer. So thank you.